our concentration is on health prevention. The entire class will be devoted to how we can live longer, not necessarily considering the country by country. We are still on Global Health Lecture Series. This is number 10. My name is Professor Silvanus Okeke. Today I want to deal with the environment in which you are born as a person. If you are born in a very bad environment, then one should not expect to live so long. Because if the environment is bad, where you are born, where you grow, where you live, where you go to school, if those things are not good, then it will affect the number of years you live here on earth. So your prayer should be, you have to be born in a good environment to be able to make it. At least live up to 84 years or 85 years like people in Monaco or people in Japan, or 79 years like people in the United States. Where you are born is very important. And indeed, for young men and women who are still giving birth, they should consider where their children are born, because it will contribute to how they live. Apart from the environment of where we are born and its effect on human beings, we have alcohol consumption as the major problem when we are considering our life expectancy or the number of years we spend on earth. When people go ahead consuming a lot of alcohol, it will affect their body because it weighs down the body. And that will not even, the person who consumes so much alcohol is not likely to do well, is not going to be attentive, is likely to be very weak. And that weakens the body. And when the body is so weakened, it means you are gradually weighing down the tissue of the body, and at the end, the person may not live long enough. Apart from alcohol consumption, we have nutrition these days where food is being planned. In the United States, in Norway, in Sweden, in Japan, most of these developed countries, people take time to plan what they eat, what we may call dieting. And even in underdeveloped countries, especially where they grow vegetable, green leaf and all things that are very nutritious to the body, they should concentrate in consuming those vegetables, consuming food that are lively, and with that, that person will live longer than somebody who does not eat well. If someone doesn't eat well, his food is not planned, he's eating all kinds of junk, then he's likely to go into our fourth program today, which is obesity. When somebody is obese, it's a problem. He could develop diabetes, he could develop some of these chronic diseases like cardiovascular disease. Apart from heart disease, the person could also develop cancer. There are so many things that go with that kind of situation. So it's good when somebody is eating well, eating plant food, that this question of obesity will be avoided. We always talk of obesity, even here in the United States, where people are so robust that they are not living well. It's good to do exercises, it's good to stop smoking, it's good to do a lot of things to help your body to live well. So obesity is not good for your body, and you develop that by eating all kinds of junk foods. Diabetes is not good for you, because once you are sick that way, you will just be carrying insulin up and down, and that will not be well for your body. Apart from obesity, apart from diabetes, we have pollution of where you live, pollution of the air. If the air is thick, if it is polluted, a lot of factories, no cleaning of where you live, that is likely going to affect someone. And the question of living up to 80 years and thereabout is not going to happen. So the best thing is to avoid staying in the polluted environment. And indeed, that is where the policymakers should come into what we are doing. The policymakers need to really do a lot of work in their planning, in housing, in pollution, safety of the environment, and even the environment. When people are elected into the houses of rep, or to the Congress, or to the Senate, they ought to take good decisions on health, because it is people who are living well that will produce. And where there is maximum productivity in a country, that country is likely to do well, because the gross domestic product will increase. So these things are in chain. If one is good, it will affect the other. If policymakers are not doing their work, when we have bad legislation, it will affect everything. It will affect pollution, it will affect housing, it will affect the environment where we live, the obesity, the nutrition, the diabetes will all be affected. But where policymakers are not fighting in the houses of assembly or senate, they are doing what they are supposed to do, they are doing their job, then most of these issues will be tackled, and tackled very well. There is inequality everywhere, and there is this health disparity where some people are not well taken care of, disadvantaged ones, even in developed countries. Here in the US, we have people who depend so much on Medicaid before they can have any kind of insurance to see the doctor. You have people who depend on Medicaid, whereas the wealthy ones are doing well, using their money, going into the best technology medically to take care of themselves. We need to do a lot of work, and that is where eating well is very important, having good nutrition. So those are the things we need to think about, even as people, if we want to live longer, your health. Thank you, and goodbye.